Hello everyone! If you've had a health checkup, you've probably had a chest x-ray. This test mainly checks for problems in your lungs and heart. One of the common illnesses that chest x-rays can detect is tuberculosis, or TB in simple term. Korea has one of the highest rates of TB among OECD countries, with about 20,000 people currently receiving treatment. So there's a high level of interest in preventing and managing tuberculosis here. Let's learn more about TB and how to prevent it together. TB is an illness caused by a germ called Mycobacterium tuberculosis. It usually affects the lungs but can also occur in other parts of the body. If someone with tuberculosis in their lungs or throat coughs, sneezes, or even talks, the germs spread through the air. Other people nearby can breathe in these germs and get infected. That's why tuberculosis can easily spread, especially in places where many people live together. Understanding how tuberculosis spreads from person to person is very important. If you know how it spreads, you'll easily understand how to prevent it. When someone with TB coughs, sneezes, or even talks, tiny droplets containing TB germs are released into the air. If another person breathes in these droplets, the germs can enter their lungs, and they may become infected. We commonly call this a respiratory infection. Let's take a look at the main symptoms of TB. At first, you might not notice any symptoms at all. But as TB progresses, several symptoms may appear. If you notice any of the following signs, please visit a hospital or health center and get tested for TB. Now let's learn about how tuberculosis is diagnosed. There are two main tests. First, they take a chest x-ray, which is like a picture of your lungs. This helps doctors look for signs of TB. If the x-ray shows possible TB, you'll have another test called a sputum test. In this test, doctors check your mucus, the stuff you cough up, to see if it contains TB germs. These two tests together can tell doctors clearly if you have tuberculosis or not. Let's talk about how you can prevent and manage TB. TB can be treated effectively. If you have TB, it's important to take medication as your doctor prescribes for at least 6 months. By consistently taking your medicine and completing your treatment, most people recover completely. So don't worry too much. TB spreads mainly through the air when someone with the disease coughs or sneezes. That's why practicing good cough etiquette is essential. But what exactly is cough etiquette? First, always wear a mask or use a tissue to cover your mouth and nose when coughing. If you don't have a tissue, cough into your sleeve instead. Second, always wash your hands properly after coughing. The best way is washing them with soap and water for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer. Also, if your cough or phlegm lasts for more than 2 weeks, visit a clinic or health center. Tell them about your symptoms, and if needed, get a chest x-ray. Finally, if your immune system is weak, you're more likely to catch TB. Keeping yourself healthy by eating well and living a balanced lifestyle is important. Small, simple habits like these can protect you, your family, and those around you from tuberculosis. Let's practice them together. Thank you for watching.